Recent discoveries in the treatment of advanced disseminated Lyme disease. Autoimmune disease, when the body's defense cells attack its own tissues and organs, leading to damage and sometimes death. Analogy, an army in disarray and confusion where the soldiers are killing each other, attacking their own bases and equipment. Sometimes the immune system acts like a confused suicide bomber attacking its patrons rather than the enemy. Autoimmune disorders are the most common chronic illness in the U.S., currently affecting close to 24 million people, which is more than heart attack and cancer combined. Frequently, there is a complete unawareness of the nature of the diseases from both patients and physicians. Trigger factors can cause symptoms, which quickly progress to full-blown autoimmune disease. The most common trigger factors are as follows. Chronic stress and hormone misbalance. Change of the bacterial content in the small and large intestine, bacterial and fungal overgrowth. Gluten. Toxins. Infection. Current treatment usually includes drugs designed to depress the immune system, which in itself creates a variety of problems. Immunosuppressant drugs and steroids are absolutely needed in acute events where their role can be life-saving. Immunosuppressants cannot be used in the treatment of chronic infections and in conditions where the triggering factor for a subsequent autoimmune disorder is infection, especially if there is a chance for the infection still to be present. Resetting the immune system to normal should be an achievable goal by waking up our body's natural ability to heal us, which is a process more complex than it sounds. This can be done through using food as medicine, removing toxins, reducing stress, and restoring the normal hormonal balance. Medicinal signaling cell and microvesicles therapies are shown to be very promising, with results both as a treatment in the acute stages as well as resetting the immune system back to normal. Recently promising results have been demonstrated in the treatment of advanced disseminated Lyme disease. Fast facts. Approximately 300,000 people are infected with BB every year in the USA. In 2015, 95% of confirmed Lyme disease cases were reported from 14 states. Connecticut, Delaware, Maine, Maryland, Massachusetts, Minnesota, New Hampshire, New Jersey, New York, Pennsylvania, Rhode Island, Vermont, Virginia, Wisconsin. Lyme disease is the most commonly reported vector-borne illness in the United States. In 2015, it was the sixth most common nationally notifiable disease. However, this disease does not occur nationwide and is concentrated heavily in the Northeast and Upper Midwest. Courtesy of CDC. The white-footed mouse and the white-tailed deer are the most frequent vectors of transmission taken to humans in the northeastern U.S. So, putting a fence around your property or spraying the lawn does very little if anything. The nymph tick is the one responsible to transfer the infection to humans because of their smaller size. After attachment 24 to 48 hours are needed before the infection is spread to the human host. Borrelia burgdorferi, BB, is a highly invasive organism but there is no evidence that it produces toxins. Therefore, all disease pathology is a result from the host inflammatory autoimmune response. Lyme borreliosis is a disease involving almost all organs and systems in the human body. Stages of Lyme disease. Stage 1, early localized, symptoms begin within 3 days of the tick bite, resembling flu infection with fever, headache, muscle and joint pain, fatigue, and skin rash. Stage 2 early disseminated, symptoms begin weeks to months after the initial infection and can involve any system of the human body. Fatigue, enlarged lymph nodes, severe headaches, cognitive malfunction, meningitis and encephalitis, paralysis, muscle and joint pain, joint effusions, heart problems, visual disturbances, any organ or system in the human body can be affected. Stage 3 late disseminated, or chronic, symptoms develop months to years after the initial infection, usually in patients, which are not treated adequately. The symptoms are similar to stage 2 but a lot more severe and permanent. While the diagnosis and treatment of the early stages is relatively straightforward, the management of the persistent and refractory late stages, advanced Lyme disease, remains controversial. In advanced Lyme disease, the infections invade and evade the immune system, causing an immune confusion and continue to affect organs and systems despite aggressive treatment with antibiotics. The exact mechanisms of immune confusion are partially understood and their complexity precludes detailed discussion in this article. In summary, there is an overproduction of T helper, TH, and suppression of T regulatory, TREG, cells. The T helper cells stimulate the overproliferation of T cytotoxic, killer, cells, including a proliferation of immature T killer cells subset which attacks the body's own tissue. At the same time, the production of antibody-producing cells is suppressed, leading to a production of non-satolytic antibodies incapable of killing the BB. These antibodies form complex with the infecting agent, BB. The antibody BB tissue complex is then attacked by the T cytotoxic cell, causing further damage to tissues and organs. The antibody BB complex travels with the circulation and continues to cause tissue damage even after the bacteria are dead. In summary, Lyme disease starts as an infection in its early stages and becomes autoimmune disease as the condition progresses, as it triggers autoimmune response. That explains the poor response to antibiotic therapy of people with advanced Lyme disease and post-Lyme disease syndrome (PLDS), subjective symptoms: fatigue, muscle and joint pain, cognitive dysfunction, and reduced quality of life after the objective symptoms of the disease has disappeared. Also the chronic fatigue syndrome. It has been observed that after exposure to BB, humans tend to show abnormal response to flu or other viral and bacterial infections. In the advanced stages, patients without or poor response to antibiotics tend to migrate to doctors practicing alternative medicine and are usually treated with dietary changes, detoxification, acupuncture, meditation, etc. In summary, all these measures attempt to down-regulate the immune system. The good news. Recent studies have shown that the microvesicles are the critical component in modulating the immune system through various physiological and pathological conditions. The transforming growth factor beta-3 TGF-beta-3 have been shown to increase the activity of the T regulatory cells and modulate and decrease the activity of the overstimulated T killer cells. That explains recent clinical success of treatment of advanced Lyme disease with microvesicles from Chimera Laboratories. Please the table above. The reason for this success is the high levels of TGF-beta-3 secreted by the microvesicles. In this future, subset of patients will be created based on the initial response to the first intravenous microvesicle treatment. The most common differential diagnosis of Lyme disease is as follows. 1. Arthritis from other causes. 2. Chronic fatigue syndrome not related to Lyme disease. 3. Other heart conditions including heart attack and cardiomyopathy. 4. Multiple sclerosis, MS. 5. Amyotrophic lateral sclerosis, ALS. 6. Parkinson disease. 7. Alzheimer's disease. 8. Polyneuropathy. 9. Other visual disturbances. 10. Rheumatoid arthritis (RA). 11. Tumors. It is important to make the proper diagnosis prior to initiating therapy because most of these conditions will respond to microvesicle therapy, making proper diagnosis a lot more difficult. There is some evidence that BB infection can serve as a trigger mechanism to MS, Alzheimer's disease. In summary, Lyme disease starts as infection and progresses to autoimmune disease with involvement of virtually all organs and systems. BB does not produce toxins, therefore all disease pathology as a result form the host inflammatory autoimmune response. Microvesicles have been shown to regulate the overstimulated immune system, which explains the current clinical success in their use in advanced Lyme diseases. In our office, the microvesicles are administered as a single intravenous infusion. Exaggeration of the initial symptoms, paroxysmal reaction, is expected 3-10 days after the infusion due to accelerated bacterial death and release of endotoxins. Significant and sustained improvement of symptoms is expected within 9 weeks. In some cases, additional infusions might be required. Other conservative measures to heal the immune system such as diet, exercise, detoxification, are known to improve symptoms. The future will determine subcategories of patients and optimize their treatment. If microvesicle therapy can be used in acute stage of Lyme disease is unclear at this point. For more information or to schedule an appointment, please call Dr. Evdokimow at 908-221-1136 or email evdokimow@gmail.com. Connect with us at www.theplasticsurgeryreference.com.